Hello, and welcome back to the Black Dental Reserve podcast. I'm your host, Dr. Bridget White, and today we're joined by Dr. Fatima Robertson, a periodontist in Dallas, Texas. Dr. Robertson received her bachelor's degree and dental degree simultaneously from the University of Missouri, Kansas City, as part of an accelerated degree program. She then worked as a general dentist for 3 years before returning to the University of Missouri for an advanced education program in periodontics. And she says her experience in general dentistry greatly enhanced her ability to serve her patients as a periodontist. Dr. Robertson is the co-owner of Center of Endodontics, Periodontics, and Implantology in Allen, Texas, which is just outside of Dallas. She is a board-certified periodontist and member of multiple organized dentistry groups. In addition to providing treatment for gum disease, much of Dr. Robertson's surgical practice is cosmetic-focused, including procedures such as gum lifts, gum grafts to treat recession, and dental implants. In July, Dr. Robertson launched the new YouTube series, Dr. Gumdrop, to showcase the world of dentistry. She is a wife to one and proud mother of 3. You can follow Dr. Robertson on Instagram at Dr. Fatima Robertson. All right, well, welcome to the show.
Thank you for having me, Dr. Bridget. I appreciate it. Thank you so much.
Oh, you're welcome. My dad is from Kansas City, Missouri. So I have to first ask you about barbecue. I mean, you live in Dallas, but if you spent any time in Kansas City, then I know you have a thing or two to say about barbecue.
Listen, you know that's a hotly contested debate about barbecue. If you have spent any time in Kansas City, and if anybody asks you what kind of barbecue you eat, you know that they're trying to figure out what your personality is, right? So, our favorite in Kansas City was Gates Barbecue. Gates Barbecue.
That's my dad. Mm-hmm. Yes.
You walk in and the servers at the front, and they're like, "How may I help you?" So it's like,
Oh,
Midwestern charm, right? And you
yeah.
say your order, and they're like, "What'd you say?" Like, you're like quaking in your boots when you first get there because you have no idea what they're saying because they're screaming at you. But that's the part of their charm. That's what they
Yeah.
in gay
Mm-hmm.
school barbecue. That's how they teach their servers to be. So it's the perfect mix of Midwest contemporary friendliness, and then that let's go, let's get out of here, let's eat this great food and move on.
Yeah.
Yeah,
Yeah,
Gates
let's
is
get it home. That's great. My dad, he's smiling down on us now because he used to have Casey Gates shipped to our house in Philadelphia. So that's the only barbecue sauce that my palate knows.
bottles in the pantry right now. I promise you I do because I get online and I order it, and that's the only barbecue sauce that's in my pantry. No matter
Oh
where
my goodness.
no matter where I go, I always have Gates barbecue. Always.
Wow.
Oh, oh,
That's wonderful. Oh man, I'm gonna have to get some barbecue. I'm gonna have to eat some ribs this weekend. This is getting me you get my saliva going.
listen,
So I'm
I live in Dallas. I have been known to, on occasion, go up the turnpike, which is I-35, just to go to Kansas City, just to spend the day in Kansas City to eat barbecue and come back home. I have been known to.
wow. Okay, all right. Well, then that's what you need. You know what? You should have a special episode on your YouTube series just about that. People would love that, and then you could do a little tips on how to get the ribs out from between the teeth. That's wonderful. Well, you have. I mean, I understand that you've lived, throughout the South, the Midwest, and I also read that you inherited an eye for design and the ability to use your hands from your parents. Can you talk about, that that aspect of your childhood and what led you into dentistry?
Absolutely. My parents are both children of the Civil Rights South. We were born, or yeah, actually, all 3 of us were born. I was born in Natchez, Mississippi. It's a small town just 2 hours south of Jackson. It's on the Mississippi River. And it's one of those cities that grew during the time when industry was coming, when cotton was a big part of the South's industry and their economy. The cotton would be moved from the ports down through the South, from Louisiana, Alabama, so on and so forth, through the Mississippi River and then into the Gulf to be spread out into different areas. So my parents were children of the civil rights. They decided that when I was about 6 years old, that it was probably time to get us out of Mississippi because consistently, Mississippi and Louisiana would toggle between 49th and 50th in education. And they knew that if there was going to be a little bit better chance for opportunity for us, they wanted to try their hand at something different. So just like so many other people, they were part of that great migration north. And that landed us in St. Louis. We ended up being there. That's actually where I was raised and went to high school. Both my parents were non-professional people. They were working class people, but my mom and my dad would do things on the side. My mom would sew, not necessarily a seamstress, but my mom would sew and she would create things. She would make all of our homecoming dresses and family reunion dresses and anything that we needed. She would make curtains and just do different things, different odd jobs. And my dad was a government worker, but he would also do some carpentry work on the side. And so my dad would go out on the weekends and he would help my uncle and his carpentry business, like lay floors and, just do all kinds of odd stuff. So that's how my parents were able to kind of make additional money. So both of them were very good with their hands from that aspect. My dad in carpentry and my mom, she could really sew anything that she saw. She didn't really need it, and she could just look at it and figure out what it needed to be. So I kind of inherited that eye for that, design or that being able to craft and construct things with my hands from both of them. And so how that ended up shaking out, why I even got interested in dentistry was because I knew I wanted to do something in the medical field, but I couldn't quite figure it out. I thought initially I wanted to be a pharmacist, but with all the chemistry and everything, I thought, you know what, it's okay. It's just not my passion. I don't think I really want to do that for the rest of my life. But it wasn't until I was probably maybe a freshman or a sophomore in high school. I went with my mom to a dental appointment. She had to have some major work done, and she was really nervous. So I had to go with her and hold her hand. And I got to see the first person that looked like me that was a dentist. His name was Dr. Dwayne Dilworth. He actually still is in practice. And he had a small office, 2 operatory practice, and he looked like he was having fun all the time. He told jokes, he laughed, his front desk loved him, his patients loved him. And I got to spend quite a bit of time with him because I had to go to those appointments with my mom. And I told him that I wanted to become a pharmacist, and he was like, "No, you don't. You want to become a dentist." And he shared with me these things. He's like, "Listen," he's like, "You seem to be good with your hands. You're asking the right questions. Why don't you consider dentistry?" And before I left the last appointment, he gave me one of his dental books and said, "Take it home and read it and just tell me what you think about it when I see you again." And I thought, wow,
Wow.
this guy is amazing. And we just kept in touch over the years. And I actually still talk to him. He's still a great guy, still practicing. And just he loves to see that I'm doing something in dentistry like we always talked about.
Wow, that's incredible. It's so amazing how an experience that you have, someone you meet, someone you see, especially in those young years, those fundamental years, when you start, where you can identify yourself, and actually place yourself in that profession, given the interest and then the representation. This person looks like you, he's treating your mother, so you're emotionally connected to that experience. And then to actually extend himself to you and show the confidence. He basically proclaimed it. You're going to be a dentist. And that means, I'm sure that was a driving force, and maybe moments of despair when you were waxing teeth up or what have you in school. You knew that he was rooting for you. Wow, that's great. I'm always curious to know about where we have found our mentors, and often it may not be an organized program. It really could just be someone down the block, your own provider, or a close family friend. That's wonderful, and it sounds like your parents were so entrepreneurial, having to think outside the box, and then to be able to move. Unfortunately, to have to move. I mean, that part, we should definitely, that's a terrible part of the past, and I think a lot of people don't understand why that occurred, right? After the Civil War, all the things that happened in Jim Crow, all the opportunities that were not made available to African American citizens, and then to have to move, and seek out opportunities in areas that were still heavily segregated and discriminatory. Can you talk a little bit about your background, your experience in Kansas City? My father, he was in the first class of integration. I believe it was Central High School. I'm not. I think that just sounds right. I mean, he was. My dad was born in '49, but you know, Missouri Compromise. At least our audience. The goal is that our audience are aspiring dentists, young dentists, and also parents that can imagine their children becoming dentists and want to introduce them to the idea of dentistry. And so I do think a lot of our narrative should include, you know, some of the challenges, social challenges, especially.
Absolutely. So, if I'm being honest, going from St. Louis to Kansas City, it was really no different. I think in St. Louis, where I grew up, it was segregated. That there were portions of town where we were welcome and certain portions where we were not. We did know that. And so going to Kansas City was really no different. There were certain portions of town where we were welcome and certain portions where we were not. Unfortunately, or fortunately, I was able to exist inside of a bubble because I was on a college campus. And so on that college campus, it tended to be a little bit more liberal thought than necessarily more conservative thought. So in that liberal thought, there was the ability for us to kind of move and have our being and kind of be different. But people would always want to know who we were, what we thought. Um, so for me, it was a little different in college. Now, dental school was a little bit of a 180 away from that because in dental school, I was on a campus where I was one of two African Americans. There were two that came along that were standing students, one from Kenya and I believe one from Egypt. But there were only two African American students in the entire class, and I believe I graduated with 9 people. And so we were the only two African Americans that were in that class. So that was quite different because although we were in the bubble of dental school, we were in a situation where we were different. We were considered different, uniquely different.
Mhm.
We had to fight a little bit harder and make our voices a little bit louder to be heard. But I didn't have a problem with that. I was I was uniquely able to get that across. Did have a very good instructor by the name of Tom Jones, who actually had been the first African American to ever graduate from University of Missouri Kansas City Dental School. And
Wow.
he was there teaching. He gave up his time after he retired to come back to the dental school to just be seen, to let everyone know that he was there. And if there were any students of color that needed him, he was always one that we could always go to and talk to and just kind of share our thoughts with. I can remember one time where there was a trip that he sponsored to go to, Venezuela. It was an
Mhm.
outreach. And so during the outreach trip, what would happen is he would select about 15 or 16 students to go with him. It just so happened that I was not one of the ones that was originally selected, but after someone dropped out, I was the one that was able to go. And what he told me in confidence was that he had been rooting for me the entire time because he saw that my confidence in clinic was not as high as it should have been. Well, that's because as dentists, sometimes I think when one instructor grades you as good, another instructor can come and tell you that it's trash. But it's just the way that we're trained. We're trained very subjectively. So I think that my confidence was suffering with that, but he was able to see it. And so because he put me on that trip, we spent 2 weeks in Venezuela treating children in orphanages. And then we spent a week in Aruba just vacationing. But that trip did so much for me. It is
Yeah.
so confidence. And I just thank God that he actually saw that my confidence was low and that
Yeah.
had I graduated without that opportunity, it probably would have taken me 5 years to even reach the speed at which my classmates were going.
Yeah, that's incredible. First of all, just having the opportunity to do that outreach with the orphans in Venezuela, and then of course having that instructor who shared that information with you, right? At a moment where it was impactful. I I agree. Going back to the schools to be seen is
Yeah,
so important. I tell my colleagues, my friends, just see if you can work one day a week, once a month. See if you can volunteer, walk the halls. I went back to teach at Penn during the pandemic, but I really, well, first of all, I wanted to see what was going on. I looked at these, I started reading the data. I was like, we're only 3%, like still.
I know.
Let me go into, and I'm from Philadelphia, so I have a unique background knowing the demographic of Philadelphia, the neighborhoods where people live. But I wanted to go back, and I really knew that walking through that clinic would be meaningful for the Black students and also the students from other backgrounds and the faculty. We have to be seen. We need to be in these conversations. We need to be in leadership positions. I think that I had a student last week just send me a note that just kind of venting about how they felt to be made inadequate, even in the clinic. And it not in a didactic way, just in a, like you said, a subjective. That's that type of subjective grading and how I feel about this. And I think that that's unacceptable. That needs to be addressed at the curriculum level. That um, you clinical instruction has so many dimensions, and it really shapes us in terms of our confidence. So thank you for sharing that story, and I'm so glad that you had that instructor. I think that you would never expect it, right? Kansas City, Missouri.
Exactly.
But that's where you got it. I mean, and I can tell. You have a flair about you, like your je ne sais quoi, your Dr. Gumdrop, right? Like your bright colors. Right now, you're wearing this green, and it's just it. I think about the your spirit shines through. It's almost like these colors give this pattern of this excitement about the profession, and I think that the fact that you kind of created your own niche with this cosmetic dental surgery. Can you kind of get into that with the excitement? Because I'll tell you, perio is gory, and even when I send patients, I'm like, oh, and they're like, is it gonna hurt? And I say, well, no, it's not gonna hurt, but it's not. It doesn't come across as the most fun specialty. So, can you tell us a little bit about how you've made it that way?
Well, so here's the thing. I think when I was in dental school, I think there are two specialties that they don't teach us a whole lot about. And I think that's probably on purpose, to be honest with you. I think one, ortho.
Mm,
They don't teach us enough about ortho. That's a very closed
okay.
off profession. That's a very closed off specialty in dentistry. It's very exclusive. So there are only certain people that they're going to allow to come to their program to become orthodontist, number one.
Mm,
Number two, I think perio is shrouded in mystery. A lot of us don't really know about perio or what perio is. We know that we see the numbers on the probing depth and we know that that person probably has something going on, but we don't teach enough about it in terms of just the basics of perio, like bacteria, plaque, things like that. All of those things are just kind of shrouded in mystery. I don't think in dental school I learned a lot about perio, but I had a really good perio faculty that was just very staunch about you got to learn this, you got to know this because this is the basis for everything that you're going to be building on top of. So let's get foundationally sound. So let's learn about perio so that when you start doing dentures or you start doing implants, you'll know about what the gum is supposed to look like and how to fix it if something's going wrong with it. So I think I had a great instructor when it came to perio. I don't think it was shrouded in mystery for me. I just kind of I was just fortunate enough to have a great perio instructor that just kind of taught that or preached that to us. But not everybody has that, and I think that it's not good because again, perio is the basis and the foundation of everything. Albeit is boring sometimes. I'm looking at gums all day, but if you think about it, the best part about that is that because I'm there, I can help you keep everything stable. I always say my tagline is I set the framework for,
oh, yeah, yeah,
and it really is.
yeah.
Make the foundation tough, and build stuff on top of it. So when it comes to perio and why I think I've been able to kind of, change that dynamic is because I do love the study of periodontics. I do love the fact that what I do actually enhances what my general dentist is going to do. And long term, the patient's going to be better for it. And I think that what I've been able to do in periodontics is I'm not so hard and fast on just the traditional placing implants and treating gum disease. I think I've been able to kind of turn that into kind of what I call a plastic surgery practice, if you will. And so it's just like doing plastic surgery on the face. I just do plastic surgery now. And I was really afraid to kind of get into that and kind of limit myself to that. But I found that I'm happier doing plastics than I am just doing all the other stuff. I think there comes a time when you just kind of pick something and move in the direction of it. And it's where God
Mhm.
has called you to be. And so for me, it's the plastics. So I do a lot of gum grafts, which means I cover a lot of teeth that have recession where the gum's pulled away. I do
Mhm.
a lot of correcting gummy smiles, which really helps with someone's confidence. And I do a lot of dental implants.
It's so true what you just said about confidence. Especially for our community, and we have to talk about the data, right? We suffer disproportionately from gum disease. We have Now we're talking about the racial discrimination we face because of our hair, our names, our skin color, always. And then on top of it, we suffer from early tooth loss. So I think the fact that you found a niche to help address disease, but also raise confidence is so compelling. I mean, that alone is stay there, do as much as you can in that space, Dr. Robertson. Seriously, and that's something that I think is really important for all dental providers to figure out what they love about the profession and where they're confident,
Yeah.
right? I wanted to do more of like public health and teach, but I have a growing child. I have a mortgage. I paid off my student loans, but I still got other debts. But I do need to have some economic mobility, so I can't sell my practice. But I like writing now. I want to write about the disparities. I want to really look at them now that I've been practicing 2 decades, and I can see trends, why they exist. I can see where we are ignored. I'm glad you mentioned that some of the specialties are very exclusive and intentionally. I actually feel like dentistry, and I'd love to hear your thoughts, but that dentistry is branded a certain way to kind of keep people out of it, not interested in it, especially in light of the fact that it is a very economically mobile industry in terms of business ownership, transfer of wealth, um, upward mobility, access to capital. So yeah, definitely. Um, I want to rebrand it for our community to show them how to see themselves, right? I mean, and you are such a great example, especially for women, young women, to say, hey, because now we have these visual mediums, right? We're like, how do I look like that? How would I look going to work? If you said dentist back in the 1980s to someone, they're like, that's not a good look. But now we can see how dynamic providers are. So first of all, thank you. But yeah, can you talk more about like how the call to action, how we can make dentistry more accessible to our community and why that's important for us to service our community and decrease our risk of gum disease?
Well, I think historically for us, I think we have always had a mistrust of medical professionals. I mean, you can go back to look at the Tuskegee experiment, just for instance. My husband actually graduated from Tuskegee University, and some of the things that were happening in that small town or in that hospital, those buildings still exist. And some of the people that were affected by the Tuskegee experiment still happen to live in the area. And so I
Mhm.
think that we've been very mistrustful of just the medical profession as a whole. I think we have mistrust of authority in terms of the police. I think we have mistrust of medical professionals at some point or at some turn in our lives. And then I think the lack of access that we have. We haven't always had the money to be able to afford the more expensive services. If there was a cavity tooth, and I was just going to mention my mother and my father. They were 1-5 and 1-7. If a tooth had a cavity in it or hurt, it just came out. And as a result of that, when I became a periodontist, I was placing multiple implants in both my parents just to restore them to a proper occlusion so that they could eat and function and not have the problems. Because remember, they were kids of the civil rights and they were raised in families of multiples. And so they didn't have time to take care or get a root canal on a tooth. It just had to come out so that it could stop hurting. So I think that there's been a mistrust, number one. I think that we've had lack of care. We've had lack of the ability to receive the services. And then three, we've had disparities in our socioeconomic status. So we couldn't afford those things. I think that how dentistry is branded now, I think a lot more of our people, people of color, are beginning to see that taking care of your teeth is vitally important. I think that we're doing a good job, or we're trying to do a good job or better job of sharing with people that if you don't have good mastication or chewing, that you won't have good digestion, and that will end up with multiple problems. Some of the things that are happening in my practice that I'm even seeing, I do see people of color. I see all kinds of people, but the people that come to me from all over, that come to me from 50 to 75 miles, are African American or people of color that come to me because they, number one, they trust that I'm going to do what needs to be done. I'm going to do it in a safe and conservative manner, but they want to be treated by someone that is a person of color, and they want to feel as though they're coming to be given the best possible care that they can have. So certainly I do see people within my own radius, 10, 15-mile radius, but the people that do come from far away are people of color. So I'm seeing that there's a trend that's turning. I don't know whether that's because of my presence on social media or whether that's because people are just beginning to learn that perio is important, but they're coming. And so I'm always encouraged about that.
That's really telling that patients are traveling far distances, and it's really important. That needs to be addressed in a state like Texas. Let's mobilize there. That may push someone over to say, you know what, I'm going to go ahead and open my practice in Dallas. I'm going to stay in the area. My sister was down there. Her husband was training at one of the hospitals down there for cardiology, and she had to take the bar down there, and then as soon as they could, they moved back up here. But it's funny because we don't think about our communities and where we are suffering, and I feel like there's this apathy when it comes to our community. I hear colleagues, they'll read the data, they'll say, oh, only 3% of dentists are Black. Okay. And then they move on with that. And I think as a healthcare provider, you should understand the demographics of the nation. You should understand the demographics of your community. And I also think that you should share in the responsibility. I believe it's only 18% of dental schools even teach cultural competency. Cultural competence. Yeah. Yeah. And I think there are going to be some, de facto cultural explorations, clinical. Oh, I have an 80-year-old Chinese American patient, blah, blah, blah. Oh, I have a 25-year-old African American male, blah, blah, blah. But I think to actually have curriculum, because it's not part of the accreditation process. So our standards don't require that dental schools teach cultural competence. And I think, first of all, that to me, I believe that's unacceptable, especially because we have an oral health crisis. There's a crisis. There are millions of children that don't get treatment. There are patients who are fearful of providers. Why are they fearful? That actually lends us into the discussion about America's history. Everyone is suffering. The medical community is suffering. Patient, if our doctors don't understand the biases they have about pain management, to know that maybe their parents were taught in medical school. A lot of us are inheriting our parents' professions, right? That Black people complain about pain. We over complain about pain. And dentists are taught in day one of dental school that pain is very serious, that it's physiological, that it's emotional, that it's personal. So I think that I don't know how, but that's like my one of the big red lights in my head, that the cultural competence part. I was lucky. I lived abroad as a child. I lived in Japan, and we went to Japanese public. My mom was a hippie. She was like, "We're going to go to Japan for a year," so we went. But we didn't have any money to go to American school, so we went to a local Japanese school. So we did whatever our Japanese classmates did, which was a great experience. And you've got this homogenous society, but the culture there is very powerful. Everything from body language, women, men, child, elder is very respect driven. And so for me, when I have a patient who's Japanese, even I read the name right away, even if they're American, second, third generation, I still appreciate the Japanese culture, how women are. I'll give you, this is a perfect example. A family of patients, the mother's Japanese. She came here as an adult. Her husband's a white American. And, I ask her how she's doing. We point out the cavities, any other restorative needs. And then, she's got the crowding. And I said, how about, correcting this, and talked about orthodontics. And then she says, no, I'm okay. I just want to just do the cavities. I'm okay. I said, okay. Then I see her husband next. And at the end of his appointment, he says, could you let my wife know that it's okay for her to make her teeth straight? I know she's really shy and she may not tell you, but she's really embarrassed about her smile. And I thought, wow. First of all, I was like applauding him for advocating for her. But I thought, yes, exactly. Just something that's not pain related, but self-esteem. And that to me, we need to be able to treat across culture. That's our responsibility. And I especially for Black patients, not to feel trust, not like you said, it's the trustworthiness of the provider, but also that they could be apathetic. It's one thing not to, it's like that you don't really care about my community, that you don't feel the need to know more about my community. In light of the fact that we have information available, that we are visible. And I went to school, I went to Princeton for undergrad. I remember freshman year in the dorm, I had a classmate. She came into our room. I don't know. We were all kind of getting to know each other. And she's like, I've never met a Black person. Yeah. And I was like, first of all, it just sounds so weird. When people say things, you're like, you don't know what to say. You don't know if they're kidding. And then they say it and they kind of feel shame because there was a group of us, And then I said, really? And this is in New Jersey. So I said, oh, where are you from? And she said, I think she's somewhere in the Midwest. I think like Iowa or something. And I said, oh, and I just went on about my day, and I don't think it was even until years later, I thought she probably met tons of Black people. She probably saw them, sat next to them on field trips and maybe even went to school with them, sat with them in study groups and church or something, but she didn't see them. Right. So I think that it's because this is after Cosby Show and all the, but to feel that you could say that and that should be explored right then. Like if somebody now today, if I met someone and said, I never met a Black person, I'd say, really? I don't think so. Let's talk about that. Like, like if you have, because they go on to become dentists. They go on to become doctors and realtors, selling people homes and not understanding the implications of our segregated history in the United States. So I'm sorry to go off on that tangent.
We have to know a culture that does not necessarily belong to us, but they don't feel the need to know anything about our culture. I
Yeah,
think we are historically respectful people. I think we're historically peaceful people. And I think that we have to know a lot about other people's cultures just to fit in and just to try and make a way to have a living, to be able to feed our children, pay our mortgage, drive our cars, because we have to work in environments where we're not necessarily going to be the majority. We've always been the minority. But I don't think that
right.
the majority feels necessary that it's necessary to know a little bit about us. And so I think that's where the cultural bias comes in. I think that's why historically it has been, like you said, only 18% of dental schools even teach cultural competency. And I think that that's sad because if it's not just our culture, but it's across the board, there are different cultures that you have to learn about. Just like you said, the Japanese are very respectful people. And so you always want to honor that. If you're talking to someone that is just, let's just say, a Middle Eastern person, and they're going through Ramadan, you want to be very respectful of that. So there are lots of things that you want to know about an Indian person going through something, one of their religious holidays. You just want to be very respectful of that. And we try to be, I think across the board, just because we have to know a lot about other people's cultures, but they don't necessarily have to know a lot about ours. And that's sad.
Yeah. Yeah, you nailed it. It's right. It's really, I feel it's social responsibility. I think that we have, the demographic is changing. It's the global majority. It is not one way. It's a large group of many groups, many religions, many cultures, many colors, intermixing what that means as well. I mean, you may have children who are, a part of a majority culture that perhaps you're not, right? So now that's a whole dynamic. And then you have providers are just kind of, we're floating around, we're orbiting the different cultures, but we need to really keep that in mind as we groom our future providers and as our, what is it, the minority majority increases. Majority.
I think that would just be helpful. Just learn emotional intelligence. I think
Yes.
that entire course, I really do. That, along with business courses in dental school, would help us fare well.
Oh, yes. Bookkeeping, accrual accounting. Yes. 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 Wow. Well, Dr. Robertson, thank you so much. Is there anything you want to talk about? Do you want to say, a call to action for young children who may not have thought about dentistry, or perhaps maybe some insight for some dental students who may be going through time where they do feel they're they're underrepresented at school on the class level as well as faculty. Do you have any inspiration for them?
I would say certainly if you're in dental school and you're making it through, one of the things that you've got to learn, which I'm sure you're already learning, that you've got to have tenacity. You've got to build that core muscle, which tells you that you're going to make. You got to close your eyes and see the end from the very beginning. So before you even start dental school, you've got to know, listen, I'm going to make it through. There was something on social media last night that I saw, and it was a video of a honey badger, an animal called a honey badger. And apparently, the honey badger is so tough. It's equated to what we call the wolverine here in America. But the honey badgers all over South Africa. They're tough and vicious animals. They got this thick skin, and they just got incredible will to win and to survive. It was
Mhm.
actually attacked by three cheetahs, and it actually won. And it walked away as if, I'm doing it. Now, it was obviously hurt, right? But
Mhm.
that's what I like through dental school. I mean, I was obviously born to I was tortured. I had to cry sometimes. Sometimes I just had to put on a fake smile and just make it through. Dental
Mhm.
school, professional school is tough. But what you got to know is that you're going to make it. So close your eyes and just see the from the beginning. You're going to make it through. Have the faith, one foot in front of the other. Every single day, have the will to survive because you are going to be or DMD no matter what. No matter what. If it takes you more than this 4 years, keep at it. And that's with anything in life.
Wow. Well, thank you. That resonates. That makes me feel good just every day. Every day, like you said, every day you're practicing, you're inspiring, you're growing, and you're creating beautiful smiles. It's like, sometimes it sounds cliche, but that's actually what we do. We make people smile.
We absolutely do.
Well, that's great. Well, thank you so much for joining me and helping us build this Black Donor Reserve. I look forward to more collaborations with you. And I will talk to you soon.
Thanks, Doc.